but there are very few specialists and clinics for people with a yeast intolerance. I'm going to say something that might offend a lot of people, but if you look online, there are a lot of quack doctors with different treatments for yeast intolerance. Body cleansers, pills, holistic treatments. 90% of them are complete bullshit. They don't work. And I'm just going to say that. And I don't want to offend anyone. It's just the truth of the matter is that without diagnosing an individual, it's very difficult to treat that infection. So what they're trying to do is use all the holistic means to cleanse the body. It doesn't work. The pills that effectively kill the yeast, it doesn't always work. In many instances, it makes people much, much more sick, which is why I call them quack doctors, because sometimes they do more harm than the wellness they're trying to increase in people. If you are manic and depressed, ask yourself if you are showing symptoms of a yeast bacterial infection. If you are, go and have yourself cleansed by using medicines prescribed to you from the doctors. Look at what it is that increases the yeast bacterial within the body to grow, and find a diet that removes that growth whilst giving you enough sugars to continue your life without feeling lethargic and unhappy and sick. If you are not suffering from a yeast bacterial infection, then you probably are suffering with a type of depression that may be psychological, because this isn't a cure for all people suffering with manic depression bipolar. A lot of the time, those people will be suffering from some actual type of psychological depression. It could be because of psychological abuses in childhood. It could be because of a psychological trauma. There's a lot of psychological reasons that people become depressed. But the problem with that depression is that a lot of people suffering with permanent ethanol poisoning are confusing the diagnosis and confusing the symptoms. So by treating this yeast intolerance, we can remove a huge amount of people from the psychological establishment's systems of diagnosis. And they can begin to use their resources for people who are actually suffering from psychological trauma. People with schizophrenia, people with split personality disorder, people suffering with psychosis, they need the full treatment, and a lot of people are taking away the time the doctors need to spend with them because they're suffering from manic depression. At the same time, if we can cure society of this problem, huge amounts of wealth and money and time that is being spent trying to treat these people for the remaining time of their lives. A lot of these people are forced to leave workplaces because they're not capable of coping. If these people are treated and made better, all that resource and time can be spent on other diseases like cancer and HIV/AIDS and other serious diseases. That doesn't mean that this isn't a serious disease. Manic depression bipolar is very serious. It causes suicide. Causes really, really severe issues to the people that are being affected. It's overloading the prison services. It's overloading society. It's overloading families. It's causing very severe issues. I've tried to keep this under 60 minutes. I think I've got about 2 minutes left. I'm going to leave this on the internet, in videos, on platforms, so that people can share it and spread the word. Email it to doctors, email it to people suffering with manic depression. I don't think that I'm incorrect, but I may be incorrect. This may not be. Bipolar may not be caused by yeast infection, but when you consider that yeast infection causes ethanol poisoning, to me it seems very obvious that the disease is permanent ethanol poisoning. It's like having a drip of ethanol continuously for many years, and it can lead to heightened thinking, can lead to heightened behavior, especially when people are youthful and energetic and emotional and stressed. So just think about it, and think about how you can improve people's lives who you know may be suffering. If someone you know has depression and they're not capable of going to the doctors and getting treatment, then take them to the doctors and help them get treatment. Because a lot of the time they're so suppressed psychologically, emotionally, and physically that it's difficult for them to go and have those minor ailments treated. You might save a friend's life. Thanks. Bye.